Welcome to Clinical Tools Library, evidence-based scales and questionnaires designed to support healthcare professionals in practice. The Patient Global Impression of Change assesses a patient's overall perception of improvement or deterioration following a medical intervention. It evaluates changes in health status by capturing subjective reports of symptom severity, functional ability, and quality of life. This tool is commonly used in clinical trials and practice to measure treatment outcomes in chronic conditions such as pain disorders, neurological diseases, and psychiatric illnesses. Its main purpose is to provide a standardized, patient-reported outcome that complements clinical and objective measures. The assessment enhances understanding of therapeutic effectiveness from the patient's perspective and aids in clinical decision-making. The Patient Global Impression of Change is indicated primarily for adult patients experiencing chronic conditions characterized by subjective symptomatology, such as chronic pain, fibromyalgia, and depression. It is most useful in clinical contexts where patient self-assessment of overall change in health status is critical for evaluating treatment efficacy. This tool captures the patient's perspective on their improvement or deterioration over time, making it valuable in both clinical trials and routine practice. Its application is especially relevant in conditions without definitive objective biomarkers, where patient-reported outcomes guide clinical decision-making. To perform the Patient Global Impression of Change, present the patient with a single-item scale, asking them to rate their overall change in condition since the beginning of treatment. The question typically reads, "Since the start of treatment, how would you describe your overall change in condition?" The response format consists of a 7-point Likert scale, ranging from very much improved to very much worse. The patient selects one category that best describes their perception. Record the response as a numerical value from 7, representing very much improved, to 1 indicating very much worse, or vice versa, depending on the scoring protocol. Interpretation of the patient. Global impression of change is based on the selected category, where values in the upper range, such as 6 or 7, indicate substantial improvement. Values around 4 suggest no change, and lower scores denote worsening condition. Clinical use often considers ratings of 6 or higher as a meaningful improvement. This scale provides a subjective global assessment and should be integrated with objective clinical measures for comprehensive evaluation. Sensitivity refers to the ability of a test to correctly identify patients who have experienced a true change, whereas specificity denotes the capacity to correctly identify those who have not. In the context of the Patient Global Impression of Change, sensitivity measures the proportion of patients who report improvement when an objective measure confirms clinical improvement. Specificity assesses the proportion of patients who report no change or worsening when there is no objective improvement. Studies indicate that the Patient Global Impression of Change demonstrates sensitivity values ranging from 0.70 to 0.85, and specificity values from 0.60 to 0.75, depending on the clinical population and comparison standard used. For example, in a chronic pain setting, a sensitivity of 0.80 suggests that 80% of patients who have objectively improved are correctly identified by the Patient Global Impression of Change as improved. Conversely, a specificity of 0.70 indicates that 70% of patients without objective improvement are accurately reported as not improved by the scale. These metrics highlight the Patient Global Impression of Change's moderate accuracy in reflecting patients' perceived clinical status. The Patient Global Impression of Change test was originally developed in the early 1990s as a single-item patient-reported outcome measure to capture a patient's overall perception of improvement or deterioration in their health status over time. Validation studies have demonstrated its strong psychometric properties, including reliability, validity, and sensitivity to change across a variety of clinical conditions such as chronic pain, depression, and neurological disorders. Research conducted by Hurst and Bolton in 1996 established the test's criterion validity by correlating scores with established clinical measures and patient satisfaction indices. Subsequent investigations by Guillot and colleagues in the early 2000s showed that the Patient Global Impression of Change had a significant correlation coefficient, often exceeding 0.8 when compared with changes in disease-specific instruments, supporting its construct validity. Further work by Farrar and colleagues confirmed its responsiveness, illustrating effect sizes that were clinically meaningful and consistent with patient-reported improvements measured by more comprehensive scales. Additionally, meta-analyses of trials utilizing the test have reinforced its utility as a concise yet effective tool for capturing patient-centered outcomes, particularly when assessing treatment efficacy in clinical research settings. Thank you for watching. For complete information and official PDF resources, visit clinicaltoolslibrary.com or check the link in the description below. And don't forget to like and subscribe for more clinical insights.